My name is Wayne Hintz. I'm a BSN MSN student for National American University. This is LP2 Assignment Curriculum Development, part of the NS 6215 Nursing Curriculum and Program Design Instructional Methods and Strategies. So, greetings. My name is, again, Wayne Hintz. I'm a cath lab nurse. I'm here to discuss nursing education and continuing education, discussing specific and non-specific education to cath lab and critical nursing, and then additionally a follow-up competency at 1-year follow-up. So some of the research that I conducted, I discussed with several senior nursing staff and the director of the cath lab, and we polled several nursing staff and new staff regarding the need for nursing-focused education or continuing education. Staff members were asked what training needs would you focus on if you had the opportunity to improve nursing care, and these are some of the answers that they came up with. Number one was additional education and competency assessment. So we're focused on the need for continuing education. So on-the-job training, mentorship, and potential for nursing fellowship depending on the specialty, to improve competency among nursing staff in a high-stress, fast-paced environment, and develop a robust continuing education program for new cath lab nurses and tenured staff members as well. So my proposal is the Heart Hospital Nursing University, or HHNU. And what this is it's a online tool or a classroom-driven tool to help establish guidelines for uniformity among preceptors and to develop nursing skill labs for RNs without previous experience. So the ability to hire new RNs in this position is very, very difficult because of their lack of experience in this situation. So this would also help develop those skills as well. Simulation involvement following a 1 year of employment. Maintain competency by implementing cath lab nursing scenarios twice yearly using external experts in conscious sedation, discussing critical care skills, ACLS protocols, any cath lab equipment that's specific to our job, and cold blue scenarios as well. So some of the learning objectives that I am proposing is to work on improved moderate sedation skills, enhance cardiovascular anatomy and knowledge, increased ability to anticipate any provider's next step in the procedural process, whether that's grabbing an additional piece of equipment or being ready with the balloon pump if that's needed as well. Improve comfort when dealing with code or near code blue situations. We deal a lot with ACLS protocols, but what happens before the patient actually reaches to the point where they need to code blue? Increased hemodynamic knowledge. Most nurses in the cath lab have a good, robust knowledge of hemodynamics, but they need a more of a challenging perspective when it comes to that, because if you do it so often, it becomes mundane, and we need to advance those skills as well. So some of the projected outcome, nurses in all phases of employment will have the same initial training. Nurses will have continued competency assessments. That's important to make sure that they're maintaining that competency rather than just clearing your initial training and then not having any additional assessment. Adjunct facility or nursing leaders in perioperative areas would assess the skill set of nurses using evidence-based practice. Minimal to moderate cost impact on department budget. I'll go through the costs here in a little bit. Improve patient satisfaction scores. Anytime that we improve patient care, we'll improve patient satisfaction scores, which increases our reimbursement rates. Reduction in near miss or sentinel events. We obviously want to avoid any and all of those. So length of training. The training that I'm proposing would be an 8-hour training day. It would be 4 hours dedicated to didactic information, classroom time, and then 4 hours would be dedicated to simulation and exam time. So it gives you a 4-hour classroom portion to review any of the material, and then 4 additional hours to actually be tested in the simulated environment under normal case scenarios, as well as the most advanced and severe cases that we deal with. So some of the resources that we need. So preparation time, obviously we would take one person about 15 days to develop this course curriculum, since it is an 8-hour day course. A 1 day to collect training aids and expert personnel, and 1 day prior to the event, the coordinator would need to prepare material and equipment and set up classroom and simulation room. So all in all, we're talking about 17 days to complete the development of the curriculum and then to set up the training for the nurses in the cath lab as well. So 17 days is a relatively small number when you consider this. So additional resources needed. Presenters will be utilized from the cath lab and from this facility cath lab, as well as adjunct trainer from a local facility cath lab within a 100-mile radius. And nursing consultants are available for cath lab expertise, $82 per hour. up to $1,200 per day, which includes travel and meal expenditures provided by a facility. Those costs are rather expensive, but you can minimize those by using local cath lab staff who are experts in their field. Classroom with necessary IT products and support available at the facility, available procedure space. We want to make sure that if we're using a simulated scenario, we want to make sure that it's as real life as possible. Materials will be open or expired products, so no additional costs to the facility. Marketing costs would not be incurred, as there will be this will be internal training. However, if we want to develop it into an external situation, the university into an external program, we certainly can do that. Obviously, it will cost additional marketing costs. Beverages and or snacks would be provided at a cost of about $10 per attendee to the facility. Okay, so let's talk about overall cost here. So I broke it down into two different costs, one projected with a consultant and one projected without a consultant. Obviously, the difference is about $3,000. It may not seem a lot, but when we're talking about such a small area, such a small perioperative area, the impact can be large at a lower cost. However, at the expense of $3,000 extra, we can actually bring in an expert to discuss things that we may not have seen or may not have run into for a while. So again, this is a one course cost. So this is the cost of one course, one round. So it would be one course per year. This would be the average cost. So why is this necessary? Any nursing skill is a perishable skill set. Unless you involve continually evidence-based practice, continually evolving evidence-based practice, competence will steadily decline. Inclusive and comprehensive evaluation of nursing education for the cath lab, improve patient satisfaction scores with improved care. New employees and tenured employees continually reassess to ensure competency. Again, we talk about the initial competency assessment and then they never get an additional competency assessment. So it's important to reevaluate their competency. Evaluation of competency using real-life scenarios and equipment in a controlled environment. Again, it's important to get them in the cath lab and to go over those scenarios that we don't see very often and to start off with the normal routine case and then develop it into a code blue or near code blue scenario. And also it helps develop camaraderie with providers and nurses, especially in the department where you have tenured staff. It's hard as a new person to come into that role and to get into that same rapport that you have with the providers and the nurses. So this will actually help build some of that teamwork. So thank you for listening to this proposal. I hope you enjoyed it. I enjoyed putting it together for you, and I appreciate your time and effort. Again, here are my references for this presentation. Thank you again.